But just to remind you a little bit about what we've been doing for both essential workers and for those that have been displaced. We talked yesterday about a new portal for childcare, but again, you can't talk about the workforce, those needs of essential workers, and those that are active and searching for job opportunities that have been displaced without talking about the need to take care of their children. Some 20,000 vouchers have been set aside in our efforts to address the child care needs of thousands and thousands of critical frontline employees. We also put that site up that identifies over 28,000 slots that are available today. If you go to that site on covid19.ca.gov, you can just type in your zip code and you can see a number of licensed facilities in and around your community with available slots and information about health and safety and quality assessments that our team has put together. But child care has been foundational, and we've got more work to do in that space. We'll have more resources to invest in that space coming from the federal government, some $350 million that we'll be working with the legislature to distribute as quickly as we can. But again, very grateful for the work at the Department of Social Services and their emphasis and focus on child care in this state. Accordingly, we focused on sick leave. There was a gap with the Federal CARES Act as it relates to sick leave, or subsequent acts of Congress as it related to sick leave, protecting smaller employers and employees, which was critical. But we wanted to make sure that those in the food chain, from our farm workers to those that are packing, those that are preparing, those that are distributing, those that are there on the front lines in our grocery stores, larger employers also had sick leave protection, those employees getting that protection. And so that's something else we're very proud we were able to advance an agreement in that space. And again, just want to applaud the Grocers Association working with UFCW, one of the largest grocers union in the United States, for their outstanding willingness to contribute and put aside their differences and contribute to the needs of these critical employees. We also announced a series of other things that we wanted to do for our frontline healthcare workers, care for caregivers. You recall a few weeks back we announced efforts to provide stipends for these caregivers, people at skilled nursing facilities that were spending the night in their cars because they were scared of going home and potentially contaminating or infecting their community or their household. We wanted to address through stipends their needs to address just day-to-day necessities. And we have already been able to distribute some 36,000 stipends in that program. We have the capacity to do up to 50,000, and we have more people signing up every single day. But over 36,000 stipends have been distributed just in that program alone. And that, again, was in partnership with philanthropy. And we're very grateful the private sector stepped up and helped supported those efforts. Accordingly, those individuals that were spending the night in their cars, many of them no longer are, because we've been able to book over 78,000 room nights, 78,000 room nights, free or deeply discounted hotel rooms for our caregivers, for our frontline workers across the spectrum in the healthcare delivery system. We're very proud of that. Thousands and thousands of individuals being able to take a shower, isolate in a room, go back to work, come back, and just have a place they can call their home, their own, before they get home and back into their communities. And that program's really just taken off and has really delivered on the promise that we promoted. I recognize we can always do more, and we're trying to do more still, but over 78,000 room nights is a wonderful start. The program just started ramping up a few weeks back. We've also been pushing a series of other efforts to take care of people, particularly in our skilled nursing facilities, working with caregivers, with our IHSS workers as well. We've been doing these wellness checks, not just at SNFs, but in the IHSS system. We've been able to do 173,000 wellness checks. We made some agreements with some of our largest unions in the state to allow additional resources to provide that additional attention to vulnerable Californians that are in and part of the in-home supportive service program, which is really the backbone of keeping people at home so they can live in dignity and live in place so they don't have to end up in our adult facilities, our assisted living facilities, in some cases, even our SNFs. And so that was a foundational principle and effort, and I'm very pleased by the incredible work of those teams of people all up and down the state to be able to check in on 177,000 people. We talked about augmenting the workforce, and we had some remarkable numbers. This Health Corps announcement we made a number of weeks back, it was all around focusing on the surge. Remember, we talked about the surge and the need not just to find physical beds, alternative care sites to hospitals and the like, but enough PPE, which I'll get to in a moment, and enough personnel that we can surge in to help support those alternative care sites. We had a universe that was quite large of a potential work group. We, fortunately, to this date, haven't needed them. Tens of thousands of people filled out applications on the site. I mentioned a few weeks back, some of them were duplicates. Some of them didn't necessarily work to meet our needs. But there are hundreds and hundreds of people that were hired through that healthcare, or rather Health Corps effort. And I just want to acknowledge their incredible work. We primarily focused on the skilled nursing facilities. We have, just as an example, this is a modest example, but impactful example. We've been talking about these strike teams, these efforts on infection control in our skilled nursing facilities. We have, through that Health Corps website, been able to identify, just in Southern California, 87 individuals that just came off that site that are part of our strike teams and our surge workforce in our skilled nursing facilities in Southern California, 78 in Northern California, additional 35 that have been pre-deployed in and around the Richmond area in the San Francisco Bay Area. All, again, part of that program of people being plugged in through that Health Corps site. If we need more people, we'll access more people. Tens of thousands of people applied. Not everybody fits a need or appropriately applied, but the reality is that response was overwhelming and humbling, and it may be critical moving forward that we, as we begin to toggle back and make meaningful augmentations to our stay-at-home order, if we do start to see some community spread and we start to see the numbers grow, having the physical assets in place already and having this work group that we're still vetting will provide an incredibly important resource for us if that personnel is needed. I mentioned PPE. It's always important to remind people of PPE because that's a workers' safety issue and goes deep to the spirit of May Day and International Workers' Day. We got to protect these frontline employees, not just provide paid sick leave and stipends and hotel rooms and make sure that we have a health corps that can help support the most vulnerable, but also make sure that we have their protective gear. We are really pleased. This week, I announced earlier this week, we got 3.1 million new surgical masks that came in from overseas. Just in the last 48 hours, there's been 2 additional flights that have made it to the state of California. On board was 5.1 million additional units of surgical masks. We were able to get 5.2, forgive me, we were able to get 5.1 million of them distributed just in the last 24 hours. So 5.2 million came in, 5.1 million went out. This in addition to the 3.1 million earlier in this week. So 8+ million new masks, just like that in a few days. Those flights coming in, part of that larger contract that we talked about. It's very encouraging. By the way, those were supposed to come in starting May 1st. The fact that they've already come in is a very encouraging sign. And as I said, as soon as they come in, we try to get these things out. I recognize N95s are a big part of the future orders coming in, and we have responsibilities for gloves and shields and gowns and all the rest of the protective gear that is also important, not only for our essential workforce, but to broaden as we begin to reopen our economy.